Welcome to Health Virtual, the year everything changed. Wherever in the world you're joining us from, near or far, to all our amazing speakers and our invaluable sponsors and partners, thank you for being here. Together we can create health's future. Collectively, we represent every part of the health community. We're here to address the challenges and opportunities that will shape the way we deliver care now and in the future. Because this year we have faced obstacles that will change our world forever. On November 17th, 2019, the first case of COVID-19 was documented. Today, there have been more than 30 million confirmed cases and 1 million deaths, making it the first global pandemic in over 100 years. The United States has among the highest number of deaths of any nation, despite having ranked first in preparedness for a pandemic. At the start of 2020, daily PPE cost $236 per healthcare worker, and by early April, it increased to over $2,500. In addition, nearly 2/3 of U.S. healthcare workers reported PPE shortages, caused in part from over 80% of the world's PPE being manufactured in Asia, and more than 70% of active ingredients used in our medicines manufactured overseas. U.S. hospitals lost over $200 billion from March through June, and 453 of the country's 2,000 rural hospitals are in danger of closing. According to the WHO, healthcare workers represent 1 in 7 reported COVID-19 cases and at least 7,000 deaths. But with no official tally, this is a dramatic underestimate. The pandemic has taken a toll on frontline workers, many reporting distress, depression, anxiety, insomnia, and PTSD. And historically, doctors die by suicide at double the national rate. 2020 put a spotlight on these health disparities, but inequality did not arrive with this pandemic. Before the pandemic, nearly 28 million Americans lacked health insurance, and 12 million have lost coverage since February. Black, Indigenous, and people of color, BIPOC, are significantly less likely to have insurance than whites and have a much higher hospitalization rate. This racial disparity persists in zip codes predominantly populated by BIPOC, where there are 40% fewer testing sites. And 33% of Black Americans say they know someone who has died from COVID-19, compared to just 9% of white Americans. In fact, 6 Black or Hispanic people died for every 1 white person. Income inequality plays another key role in healthcare outcomes. Roughly 66% of the near 23,000 New York City residents who died had incomes below the city median. A 5% rise in unemployment during the pandemic could result in nearly 9,000 deaths from suicide and drug overdoses. And some national suicide hotlines are experiencing up to 300% increase in calls. The magnitude of this pandemic is yet to be realized and continues to highlight the shortcomings of our current health system. However, in a crisis, you showed that collaborating and innovating together can make significant advancements. Within just 3 months of the CDC's first emergency use authorization, over 175 unique COVID tests, PPE, ventilators, or other medical devices have been approved, and the first genomic test was developed in just 47 days. Throughout the world, there are 271 treatments and over 197 vaccines in development, 40 of which are in human clinical trials. One front-runner candidate moved to human trials in a record-setting 63 days and would be the first mRNA vaccine ever used on humans. Telehealth is providing more access to care than ever before. Some providers now see patients 175 times more virtually, and 76% of patients say they will continue using telehealth. In one state, telemental health visits among Medicaid beneficiaries more than doubled the previous year, in just the first 3 months of the pandemic. Regardless of these pandemic challenges, our industry continues to innovate. A new blood test can detect more than 50 types of cancer with false positive rates below 1%. Newly developed AI is capable of identifying prostate cancer with near-perfect accuracy. A digital therapeutic was approved to treat ADHD in children through a video game. Drones are now being used to deliver medical equipment, blood, and other samples between hospitals, expediting critical care and lab work. For example, a new blood test can identify signs of Alzheimer's 20 years before memory and thinking problems begin. A breakthrough gene therapy in cystic fibrosis has the potential to treat 90% of patients, and the FDA anticipates a doubling in new gene therapy applications every year. Retailers are expanding into primary care, offering comprehensive healthcare services with flat fees that can be less than copays. And digital health is on track for its biggest funding year ever, with $9.4 billion raised. This year has shown that any crisis has the opportunity to create a brighter future, one that is more equitable, sustainable, collaborative, and healthy. Let's transform the next decade of health together.